Mac, today,
Yes.
let's talk about TMD. What went wrong?
What went wrong? Why are those poor people suffering? And why do they have the problem that they have? I would like to talk a little bit about that, what I look for, but I'm more interested in hearing what you are going to talk about and how you could have prevented what went wrong. So when I look in a patient's mouth, I'm looking at the way that the teeth come together. This is very complicated. It took a lifetime for me to learn all of this, so I can't tell it in one podcast. But like anything mechanical, when things don't fit, something goes wrong. When the gears in your car don't fit, the car shimmies, it shakes, everything is not in harmony. Same thing with tires that are not balanced. That creates problems all over the entire vehicle. When your upper and lower jaw are not in harmony, when your teeth, when they contact, are not in harmony, that's going to cause a problem. A real simple example is when you bite down and one side hits before the other.
Mhm.
And you listening can just stop what you're doing right now, put your head up straight, relax, slowly close until you feel one side touch, or maybe it's both sides.
Mhm.
Another way that you can do it, and this sounds crazy, but you can make a V with your finger and
Mhm.
put a finger over each side of your teeth and slowly bite down and see if you're only biting one finger or two fingers.
With
If
those,
they're un,
it might make sense, like if you use like your pointer finger, one on each hand, and put it
you
on
can
your
use that.
lower teeth molars, and then
Good.
slowly start to close to see if
That's
both
right.
fingers are touched by the upper teeth at the same time, right?
That's right. So if you can feel one finger touch and the other has space which you can move your finger around, that means one side is hitting before the other. That is called a torqued mandible. It's not any different than having one leg shorter than the other and trying to run a marathon.
Mm-hmm.
So it creates physical, mechanical problems. My question to you, and I've said it before, I wish I would have learned how to prevent torqued mandibles and deficient maxillas and some of the other things that we're going to talk about. You can, if you're going to bend a tree, you got to bend it when it's growing. You know, if you're
Like
going to,
that.
if you're going to change facial structure, you've got to do it during the developmental stages. I
Correct.
did not learn that. And so I'm very interested in also learning what you have to say. So please help us out. How can you prevent this TMD from happening as you become an adult?
Okay. I love that question because I talk about this all the time with the infants and the children coming into my practice. So, our listeners, I just want you to listen to a story, okay? And I know we're talking about the TM joint, but everything actually, when we're an infant, our craniofacial, our facial development starts with what our airway looks like and where our tongue is positioned, okay? So, as an infant, as humans, we're supposed to be obligate nasal breathers. We're supposed to breathe through our nose. And when we breathe through our nose, it allows our tongue to sit firmly up against the roof of our mouth. You notice the tongue has a nice wide U shape to it, and it's a really strong muscle. And we swallow about 3,000 times a day from infancy through our adulthood. So that tongue really helps form the shape of our jaw. Now, if the tongue, for whatever reason, because we can't breathe through our nose, so we end up breathing through our mouth. The tongue has to sit low. It can't sit on the palate because if you guys that are listening, if you put your tongue on your palate and you open your mouth, the tongue's still on the palate. But if you try to breathe through your mouth, you cannot. So you drop the tongue down, and that's what we call a low tongue posture. Infants and children's that also have a tongue tie, that little fleshy thing under the tongue, it's called a frenum. If it's tied down at the tip or in the middle, it also causes a low tongue posture. Anyway, whether it's mouth breathing or tongue tie or both, quite often, if the tongue doesn't sit against the palate, the roof of the mouth starts to develop more in a V-shaped pattern. Okay. Instead of a U shape, it becomes a narrow V because our cheek muscles, the buccinators, and the ones around your lips, the orbiculus oris muscles, start to squish the face in narrow and also push it flat because the tongue is not pushing the palate up and making it wide. Does that make sense so far?
Yes, yes.
Now, if the upper jaw is the garage to our lower jaw, that's now the car. If the upper jaw is too narrow and pushed back, well, then that lower jaw, that mandible, is also going to set too far back. People, you guys call it a retruded jaw, or we call it retrognathia. So now, if the lower jaw is too far back, everything's too far back. Well, the tongue that's attached to our lower jaw also gets crammed back. So now we have even more narrow jaws. So we get crooked teeth. We get a compressed airway because the airway tube in our throat gets pushed back because our tongue is cramming that space. And then the joint that's right in front of our ear, that TMJ that we keep talking about, that gets pushed up and back into the base of the skull. And over years, it starts to become arthritic or it changes the shape. And so the jaw, instead of opening straight up and down, it starts to wiggle side to side, like we talked about in episode 1. Some people will hear a clicking and a popping in the joint. Some may not. It might be crackling. They might not even know that it's happening, but the joint starts to degenerate. And that degenerative joint gets worse and worse over time. And the symptoms it can manifest can be completely different, from any eye issues to ear issues to headache issues to posture issues. It can not have any signs of pain, but you just see really worn down teeth or even snoring, focus issues. In men, it can cause impotence too. So, not everybody has the same issues. It manifests differently through the course of our life, but it really starts by, it's a baby. Where was our tongue to begin with? Was it too low? Were we mouth breathing? What was the problem? And as we look at infants and a child's development through different ages, if we identify like babies, oh my gosh, it's heartbreaking when you watch babies come in that they snore and people think it's cute. It's not cute. If a baby's snoring, there's an obstruction. If they're sick, that makes sense. But if not, they're not sick. What's obstructing them? Babies, toddlers, children, and adults, we really shouldn't snore at all. So that's how things develop in the wrong way. Um, and how we can start to like look at people through the different developmental stages. And if we can identify the problems early on, we can help negate some of this. So do you want me to get into that a little bit more, Mac? Or is it too
Oh,
much?
what I okay, so the tongue is, from what I hear you say, and I know this to be true. So the tongue, to recap what you're saying, the tongue is so valuable. So it's like the clay spotter. It's molding
Mhm.
this soft jaw as everything is developing. And so it's driving everything. And
Exactly.
if the tongue doesn't do its job for
Mhm.
whatever reason, can't breathe through your nose, through sinus, et cetera, or the tongue is tethered down low and can't go up to the roof of the mouth, then that has to be fixed, correct? So
Correct.
then that's working with an ENT or working with somebody that can release a tongue.
Correct.
And it has to be found, it has to be diagnosed. You have to take your children to the dentist, to somebody that knows what they're doing so that they can diagnose this
Mhm.
and then send them to someone like you who knows how to treat them. Okay, so if the tongue hasn't done its job and what if the palate is already V and the child is young? Can you take it and can you change that V into a U? And if so, how can you do that?
Depends on the age, and yes, you can absolutely change the way a child's face is developing, for sure. You can do it with different appliances, but if we see this, and I wish we had very educated lactation consultants, because there are great lactation consultants and there, excuse me, but not so great ones. And if lactation consultants working with the mother via FaceTime or Zoom, that's a red flag to me, that they need to see what's going on when the baby's latching. But let's say we have an extraordinary lactation consultant in the delivery room and they see that that baby is tongue-tied. Well, it's so easy in the hospital to do a quick release of the frenum. If it goes unnoticed, because the tip of the tongue ties are easy to see. It's like right at the tip of the tongue. You'll see the flesh there. Those, I mean, sadly, in my son, it was missed, and I even said it in the hospital. They're like, oh, they'll grow out of it. You do not grow out of a tongue tie.
No.
You do not grow out of a tongue tie. In fact, it just tightens everything up even more later in life. But if it's one that's in the middle, those are really hard to see in infants and diagnose, is like a mid belly, or some people call it a posterior tongue tie. Those are hard to diagnose. But what moms and parents can look for is a baby that's making a lot of noise when they are latching, okay? Or a baby that has a coating of milk on the tongue, because the way the tongue works when they swallow is aberrant, like it's not the right kind of swallow pattern. It leaves a film on the tongue. Or if your baby is told that your baby is colicky, it's usually because of all the extra air they're intaking when they swallow, because of an aberrant swallow pattern, again, an abnormal swallow pattern. If you can see that your baby might have a might have a tongue tie, excuse me, and you can have that release at a very young age. And also there's very special exercises that the mother can do with their thumb on the palate of that baby to start widening it out if it's already been undiagnosed for like 3, 4, 5 months, because that palate just starts to immediately change. It's like a snare on a drum. Did I say that right? It's super thin and malleable. So it can be fixed that easily on an infant, right? And then as they grow into a toddler age, some people do tongue releases at a toddler age, but now you are going to have a hard time after you release the muscle to get that toddler to do exercises to reverse the damage, because there's exercises after a laser's been used to release the frenum. They're painful, and you don't want to put a baby or a child through anything unless you're going to be successful doing it. So there are certain windows of time where it starts to get more complicated. Not to make it sound hopeless, because even in adults, we can reverse things, but it can require orthodontic treatment at that point, and possibly sometimes even surgery. But there are different ways to change the shape of the palate once it's gone the wrong direction. But my hope, as you know, my passion is to get people to identify things at a very young age and just redirect that negative growth pattern that's starting to occur.
So in a perfect world, and the child is being born,
Mhm.
and while it's being born, you have a lactation specialist, yes, lactation consultant, and you have a pediatrician that agrees that the tongue needs to be released. And then they have to have a dentist that recognizes craniofacial development, and not too many dentists are aware of that. So we're going to have to cut that out. That's not good. What do you think, Anna?
What do you think so far?
Oh, good. Keep that's all.
She's saying it's great.
Yeah, keep going. Yeah, be
Okay,
done
okay.
listening.
So I'll recap again. Okay, so to recap, it all starts in infancy when the child is born,
Mhm.
and then it needs to be somebody that's qualified to look at the tongue to see whether it's tied and to release that tongue if it's not tied. And if there are problems, that the mothers can do something to help with the palate, that's the upper jaw. It should look like a U and not like a V.
Correct.
And what do dentists look for when they start seeing children, and what age do they start looking for craniofacial development problems?
Well, this is part of the problem again. You know, the American Dental Association thinks that we should start seeing children around the age of 3. The Academy of Orthodontics, they start screening children at 7. That's a long time. We've
It's
lost
too
huge
long.
windows of opportunities. And for me, again, if we're looking at the infants and addressing the problem, they're great. And something that you brought up, Mac, is like maybe a child latches perfectly and there's no tongue release, but you happen to have a beautiful dog or cat, and I'm a pet lover. But let's say your child is allergic to an animal in the house, then that baby or that child is going to start developing a mouth breathing issue, and things can start to go wrong then. Or like when during COVID, when we're all wearing masks, masks caused a massive issue with mouth breathing because people didn't know how to breathe through the nose well with a mask. So we're seeing a big shift, like where the kids were developing right, and then all of a sudden they're like the moms come in. Every picture I take, my kid's got his or her mouth open. And why is that? So they develop this mouth breathing habit or poor resting oral posture. So things that our listeners can look for, okay, to simple it down, is we talked about the infant, but if your child, and dentists should be looking for this too, but everyone should be looking at tonsils. Okay, tonsils are the squishy things in the back of the throat. Tonsils are there for children under 7 to help when they are sick. And past the age of 7, they should start to atrophy or shrink towards towards the walls of the throat. Okay. If they're constantly inflamed, that is a mouth breathing issue. Period. The only reasons why tonsils stay inflamed or big, because that is a child that's mouth breathing. And that's a problem right there. So we need to look at why are the tonsils are so swollen, right? The other thing that you can look for is if the little kids with their baby teeth should have gaps. They should have like jack-o'-lantern teeth, right? If all the teeth are touching, okay, in the arch, that means their jaw is too narrow because grown-up teeth are bigger than baby teeth, right? So if all the teeth look perfectly straight and adorable in a child, that's not going to look so great in a grown-up. You're going to have a problem there. And then also one other thing people may not know about this one is a deep bite. You know, if there's too much vertical overlap with the upper front teeth and lower front teeth, if the upper front teeth cover the lower front teeth completely,
Yes.
that is an issue too. And these little things that seem small in a child are going to grow into big grown-up problems later. Okay. And also big problems in kids with ADHD and sleep disorder breathing that we're seeing now all over the place.
Yes, and a special message to the listeners, you're the one that has the pain or that is interested in TMD, and why are we talking about kids? Well, because genetics plays a big part in the development of the face. If you genetically have tongue tied, if you genetically have asthma problems, you're genetically allergic to these animals and stuff, then this is what's occurred. And the message is you need to check your children out.
Yeah.
You need to start as early as you can. You need to find the right healthcare professionals that can help you. You need to find the right dentist who refers to the right orthodontist. So there's a lot of
Right.
things and responsibilities for these children if you want to prevent them from having the TMD that you have issues with.
Right.
And you can only do it when they're developing. And you have to be aware of this breathing issue. I think that's the biggest thing Pam's talked about is breathing through the nose, which opens everything out up, and then breathing through the mouth, which creates all these problems.
Mhm.
So the teeth sit. If you think about it, teeth can be moved with orthodontics. Well, the orthodontics can also be your tongue. It can be your cheeks.
Mhm.
So there's got to be equal pressure between the cheeks pushing in and the tongue pushing out so that the teeth form this perfect U and this perfect smile that these actors and actresses have. It's because everything is developed correctly. It's as simple as that.
Mhm.
So,
Exactly. So for our listeners that have little ones, like especially babies and toddlers, I know when I was a parent, when my kids can sleep through the night, I stopped checking in on them and got some sleep myself. But periodically, if you're starting to have thoughts like, does my child suffer? Go back into their bedrooms when they're sleeping. If their mouth is open, that's maybe an issue. If they sleep with their posture, like their neck up, or like with a curvature in their neck and their back, or they have to like stomach sleep, that's typically ways that kids are trying to open up their airway because they're struggling with nasal breathing. Also, kids that grind their teeth, that's typically an issue too. So, just want to create awareness, some understanding, and I hope this was helpful, not to create fear, but we
So
want to see them suffer.
someone that does orthodontics and works with orthodontics, Pam. If you have a child that's 4 or 5 or something like that, and they have this deep bite that you're talking about, they are mouth breathers, they snore. How do you recommend the listener find help for their child? Who do they look for? What's the
They can
criteria?
look for an orthodontist or a general dentist with orthodontic training, but it really comes down to who's looking at the kids correctly. I think a future podcast we need to talk about is why an orthodontist, why a general dentist, um, and why does one have one approach? Like my brother's an orthodontist, he's an amazing orthodontist. I love the orthodontic specialty, but a lot of times we're talking about straight teeth, and they do a beautiful job making straight teeth. My everything we do in our office is airway centric. We want to make
Yes.
faces grow right. So we have straight teeth as well as balanced bite, because you can have straight teeth and come in with TMJ issues and sleep issues. So it's just a different approach. There is nothing wrong with the way somebody does it as compared to mine. My goals are different. My patients' goals are different. But I wish we could all be a little bit more comprehensive. Um, so, let's
Yeah,
talk about that a little bit further in another
yeah,
episode.
but because of that, I want to add one more thing. You talked about that the jaw going back and then also the joint going back because of airway issues, which is a compressed joint. Well, that's also compressing and restricting the throat.
Correct.
And that is the main objective is get that throat open, let that child breathe, and that goes for the listeners that have TMD also.
The challenge becomes is like there's a lot of good doctors out there, but if they're not looking at people the way we are with CBCT technology and EMGs, how do they know where they're putting the teeth is the right position? And that's what it comes down to when you're looking, listeners, you have to make sure the doctor you're interviewing has the right training and the right technology to support the recommendations. And for heaven's sake, don't go to anybody's recommending dental extractions at this point.
Oh, by all means.
Do not do that. That's destining somebody. There's very, very few cases where people actually need to have teeth pulled for space. We need to learn how to help develop the jaw, recognize what caused the narrowing of the jaw, take care of that so we have the right amount of space for our teeth rather than them pulling them and then retracting everything back. So that to me is a big red flag for everybody to look for.
So I'd like to end by saying there is an art and a science to dentistry, but the art cannot violate the science. So if you've got a tooth in the way, like the case that you talked about in episode 2, where that tooth broke, is because it was made to look good, but it didn't fit the science. It always has to fit the science.
See, you're like Yoda, Mac. Way to sum it up. We could have just had a 1-minute podcast. Sorry, listeners. All right. So,
Age, my dear, age.
all right. Until next time, then.
Okay, dear. Later.
Bye.